I first would like to address the issue of coverage regarding treatment centers. If someone could tackle that.
They say they don't take state insurance, right?
Or if you have traditional insurance, they send you out of the state where your family can't even be a part of the recovery. And that's another nightmare.
That other 9% is. They may have enough recovery supports in the community, but if we don't, I really feel like we need to have a more widespread understanding of the right treatments for individuals that suffer from opiate addiction.
At any given time in our system, we do tend to show capacity, so there is availability often within our system. Work that needs to happen there around getting that level of coverage.
Thank you. There's a question there.
So when you have somebody that's an addict and they want to get help, they should be able to get that help when they ask for it. When someone says, I've had enough and I need to get help, they shouldn't be met with 6 hours in an emergency room, here's a phone number to call, and there's no bed.
I agree. And so what we've put together, even though, through the DEMA services, we primarily service.
And he was the captain of the hockey team in Trumbull High. These kids, sometimes it takes one time, how does everybody know when they can't quit coffee? You can't quit chocolate. How many in here you guys know when you can't have your cup of coffee? Can you imagine what these addicts feel like?
Today, I would not have been able to survive the pain. I would have had to end my life. And unfortunately, today, all over America, thousands of people are committing suicide daily because of forced opioid reductions.
Treatment. It's a very touchy and fine line. So a lot of times what happens is, hey, John, call this number and they're going to give you, they said they got a bed available. So John gets on the phone and he calls and he misreports. And the family doesn't even realize what just happened. And next thing we know, we don't have a bed. They don't have a bed for me. So I think what we have to do is we have to be able to take the pressure off the families.
One of the questions had to do with the prescription of opiates in excess, if that would be present.
Yeah, I think that has been, it's a challenge, because on the one hand, a lot of the data suggests that individuals who are grappling with heroin started on opiates, and so there is, as you mentioned, there is work to sort of look at the opiate prescribing and prescription painkiller prescribing practices. And that is going to have implications potentially for individuals such as yourself that are grappling with pain. So it's a systemic challenge, I think, that the healthcare community is grappling with.
My name is Linda Clower. I'm president of the Pain Management Nursing Association in the state of Connecticut. And you're right, pain patients are being targeted, and they are having a hard time. They're doing that, and they do. When you are prescribed medication in the state, the majority of the physicians in the state do urine drug screening. There's a prescription monitoring program that's in place. It took us 5 years to get it through your legislature in the state.
When somebody overdoses, yeah, we give them phone numbers and resources, but we're giving it to families that are so emotionally, broken, and we can't expect them to be able to make the correct decisions on what to do next for their loved one. So I think something that could be talked about or down the road that we can look into is when this happens, we don't just provide them with numbers and everything else. We give them a professional that knows the system, that knows, when we talk about getting somebody into treatment, a lot of times families don't realize this can be sabotaged. So if that individual gets on the treatment phone screening process, which is all over the country, it's mandatory. You have to do a phone screening.
I was in a motorcycle accident. I got addicted to pain meds at Bridgeport Hospital, and from there I lived 3 blocks from Father Panny Village, and I learned how to buy drugs. And I bought them, and it ruined my life, and I went to prison 3 times, and the state of Connecticut saved me. But there's hope. Don't give up. Don't give up. Keep calling, keep reaching out. Thank you.
Sir, thank you.
When somebody overdoses, yeah, we give them phone numbers and resources, but we're giving it to families that are so emotionally, broken, and we can't expect them to be able to make the correct decisions on what to do next for their loved one. So I think something that could be talked about or down the road that we can look into is when this happens, we don't just provide them with numbers and everything else. We give them a professional that knows the system.
And they do. When you are prescribed medication in the state, the majority of the physicians in the state do urine drug screening. There's a prescription monitoring program that's in place. It took us 5 years to get it through your legislature in the state. And the pushback mainly was from consumer groups because they didn't want people looking into their business.
Commissioner couldn't have said it better. It's all hands on deck. We need everybody if we're also going to be doing the prevention. So it's helping our families. We know in Stratford, families have a really hard time having that conversation.
Better handle what's going on. And it works so well there that we brought it here tonight. So, you know, I'm one of them from Trumbull that we're actually getting things done. JP signed on as well for the Fairfield in Trumbull, and we have some more people.
I just find it unconscionable. So I just want to hear what your position is.
I want to answer the second question, which was what have we learned from the other cities? Somebody?
Heroin DUIs are on the rise, pretty bad. The legalization of marijuana is also causing people to think that drugs are okay.
The drug. And number 3, what are we doing at the Board of Education level or at the municipal level to prevent young people from engaging and using this drug?
But everything she said is right. The reports coming from the states that have legalized marijuana are pretty bad. Especially property crime rates, the rates of absenteeism in schools and work and the lost productivity. It's a very bad ripple effect.
Look at what's been studied in the other states regarding legalization of marijuana because it's not as successful as it's made out to be on the media. So you really need.
And their children have died of heroin overdoses in their 20s. I can't even talk about it.